Welcome to Module 5 of our Anal Cancer Patient Education Series, The Late Side Effects of Radiation. My name is Emma Holliday, and I'm a GI radiation oncologist here at MD Anderson. Radiation can cause what we call late side effects that can happen months or even years after radiation has been given. These are also sometimes called long-term side effects. Radiation causes inflammation during treatment, and the body heals this inflammation by forming scar tissue called fibrosis. Fibrosis is a good thing when it happens to the tumor. However, when fibrosis forms in normal organs, it can potentially cause damage. One place radiation fibrosis can occur is in the skin of the perianal and groin areas. Fibrosis here can cause long-term or permanent changes to the color of the skin. The skin may become dark, thick, dry, or rough. Although radiation treatment for anal cancer will not impact the hair on your head, it could cause your pubic hair to fall out. And any hair that falls out during treatment may grow back in a patchy or different way, or it may not grow back at all. Radiation for anal cancer can cause late bowel side effects. We have them organized here from most common to least common. Most patients say that their bowel function never quite returns to normal after radiation. Most patients say they have more bowel movements per day than they did before treatment and may experience chronic diarrhea. Some patients say that their bowel movements are more urgent than they were before treatment and can be triggered by eating, drinking, or exercise. Many patients experience occasional rectal or anal bleeding for years after treatment. Having large or firm bowel movements can trigger this bleeding. On the other hand, some patients experience constipation symptoms after radiation. Constipation symptoms can happen if the anal canal becomes more narrow from scar tissue resulting from treatment. This is called anal canal stenosis. Anal stenosis can increase the chances to develop what is called an anal fissure or tear in the anal lining. This can make it very painful to pass bowel movements. Patients who experience anal stenosis sometimes have to keep their bowel movements soft using daily stool softeners or laxatives. If bowel movements become too difficult to pass, some patients will need to use dilators to gently and gradually stretch the anal canal. Rarely, patients may need to have a procedure where the anal canal is dilated by a gastroenterology doctor under mild anesthesia. There is also the possibility that the anal sphincter muscles may be damaged by radiation scar tissue. If this happens, the sphincter muscles may not be as tight after treatment, which can lead to difficulty controlling bowel movements. For some patients, this only happens occasionally. However, some patients do lose control of their bowel movements altogether. Based on research studies, approximately 2 to 5% of patients have bowel control problems so severe that they need a surgery and an ostomy bag to fix it. The most rare side effect, but the most serious side effect of radiation on the bowels is the possibility that scar tissue can form in the bowel itself. If this happens, there can be narrowing or adhesions that cause bowel obstruction. This rare side effect can require emergency surgery, potentially needing an ostomy bag to fix it. Radiation can lead to late bladder side effects, but in general, late bladder side effects are not as common as the bowel side effects we just discussed. If radiation scar tissue does form in the bladder, it can lead to a loss of bladder capacity, meaning you can't hold as much urine for as long as you used to. Some patients tell us they have to urinate more frequently because of this. Some patients will also occasionally notice blood in their urine, and some patients tell us they have pain or bladder spasms that require medication. The least likely, but most serious side effect that can happen is an abnormal communication between the bladder and bowel called a fistula. If this happens, it may need to be treated with urinary diversion or surgical removal of the bladder. Radiation can lead to long-term or permanent changes in sexual function. Many patients tell us that they experience vaginal dryness or pain when they have vaginal intercourse after radiation. This happens because radiation scar tissue can make the vaginal canal shorter and more narrow. Sometimes patients will have vaginal bleeding after intercourse. Many patients also tell us they experience erectile dysfunction after radiation. Erectile dysfunction is the inability to get and or maintain an erection firm enough for penetrative sex. This can happen because of radiation damage to the blood vessels that go to the penis. Some patients tell us they have a smaller amount of ejaculate or they have dry ejaculate when they reach orgasm. Rarely, men tell us that ejaculation is painful after radiation. This can happen because of radiation damage to the prostate gland. For people who have anal receptive intercourse, narrowing of the anal canal due to scar tissue can make anal intercourse difficult, painful, or even impossible after radiation. Radiation can also lead to hormonal changes and can impact fertility. Any patient who wants to have a baby after radiation treatment will need to meet with a fertility specialist before starting radiation. Radiation to the pelvis almost always leads to ovarian damage that can cause infertility, sterility, and premature menopause. Women who want to have a baby after pelvic radiation will need to undergo egg harvesting and freezing. Additionally, women who want to have a baby after radiation will need the help of a gestational surrogate because radiation damage to the uterus means you will not be able to carry a baby safely to term. Also, for women who have not yet gone through menopause, radiation to the pelvis usually causes menopause to happen. Women can discuss the pros and cons of estrogen supplementation after treatment. Radiation to the pelvis also causes at least a temporary decrease in sperm counts. For some men, the reduction in sperm counts will be temporary, but for others, it will be permanent and they'll develop infertility. Men who may want to have a baby after treatment should collect and bank sperm prior to starting radiation. Finally, there are some studies that suggest testosterone levels can decrease after pelvic radiation, which can impact fertility, sex drive, energy level, muscle mass, and other body systems. Men can discuss the pros and cons of testosterone supplementation after treatment. Radiation can lead to side effects in the bones and soft tissues of the pelvis. Radiation often causes stiffness in the muscles and joints of the pelvis, including the hips and low back. Pelvic radiation can decrease the density or strength of bones in the pelvis and low back as well. This can lead to an increased risk of fractures, which can be painful or require medications or other procedures to fix. This side effect is more common in women and those over the age of 65. Rarely, radiation can cause damage to the lymphatic channels that drain fluid from the legs and genitalia. As a result, some patients will develop swelling of the legs or genitalia known as lymphedema. Even more rarely, radiation can cause damage to the nerves in the pelvis. This is called neuropathy. Neuropathy can lead to pain, loss of strength or feeling in the legs, or even loss of bladder control or bowel control. Every patient's side effect profile is different. Your radiation oncologist will discuss side effects with you at each follow-up visit and will make recommendations for medications or other interventions as needed. Here are some things they may suggest that could help. To manage long-term bowel problems, some patients will have to modify their diet or eating schedules. Keeping a food and bowel movement journal can help you identify your own personal patterns. Some patients continue to use medications to help with bowel problems. For diarrhea, loperamide can be taken up to 8 tabs per day. Some people find it helpful to take half a tab or a tab of loperamide before traveling, or if they know they're going to be in a situation where they may not have easy access to a bathroom. This can reduce anxiety about urgency or bowel accidents. For loose, frequent, or erratic stools, taking a daily fiber supplementation such as Metamucil can actually help to bulk up the stools and help them pass more completely and in fewer total bowel movements. It's usually best to take a concentrated solution of Metamucil. This means you take the recommended amount of Metamucil powder and mix it with 2 ounces of water so it's more concentrated. After you take this, you should avoid consuming extra fluids for at least 30 minutes after. Taking a daily magnesium supplement, 200 milligrams, available over the counter, may also help to normalize bowel movement consistency. For problems with anal sphincter muscle control and bowel accidents, doing pelvic floor exercises such as Kegels can help strengthen the muscles that help control bowel movements. A formal physical therapy program with a trained pelvic floor physical therapist can also be helpful. To manage long-term sexual problems, there are certain things that can help. For women, vaginal moisturizers or vaginal estrogen can help with discomfort and dryness. Your team will provide education about using a vaginal dilator starting 6 weeks after radiation has ended. Most research studies suggest using a vaginal dilator at least 3 times a week for at least 10 minutes per day, and have shown that this can help prevent vaginal stenosis from becoming as severe. Pelvic floor physical therapy can also help with vaginal pain. For men, your team may recommend prescription medications for erectile dysfunction or referral to an erectile dysfunction specialist if you need it. Testosterone replacement may help some men who develop low testosterone levels after radiation. For people having difficulty with anal receptive intercourse after radiation, using a graduated set of anal dilators starting 6 to 12 weeks after radiation is ended can help decrease the degree or extent of anal narrowing and scarring that happens after treatment. To manage bone and soft tissue problems after radiation, gentle stretching of the hips and thighs can maintain or improve range of motion after pelvic radiation. Yoga poses and stretches known as hip openers are particularly helpful. If you develop pain or stiffness in your low back, hips, or thighs, let your treatment team know, and they may recommend either imaging or physical therapy. Ask your treatment team if bone density testing may be appropriate for you. People with low bone density or osteopenia may benefit from taking vitamin D and calcium supplements. People with very low bone density or osteoporosis may benefit from taking prescription medications to strengthen their bones. Although some patients will recover completely after radiation for anal cancer, most patients, at least to some degree, tell us they need to adjust to a new normal. About half of patients tell us they continue to have trouble with their bowel movements for years after radiation is done. About 3/4 of patients tell us they have some sort of trouble with their sex life for years after radiation is done. Fortunately, long-term bladder problems are not very common. Your radiation oncology team will be here for you to help you work through any issues you may experience and offer you treatment options or support. Thank you for your attention. Although not all patients will experience the side effects described in this presentation, it's good to be prepared. Be sure to ask your radiation oncology team any questions you have about the long-term side effects of radiation treatment. Thank you.